In September of 2017, Linda Scottson submitted a thesis for the degree of Doctor of Philosophy at University College London. The name of the thesis is Inquiry into the Possible Influences of Breathing Quality on Outcome in Children with Cerebral Palsy. This thesis is available via Amazon. It's in Kindle form only, and the price is $95. So if you're a librarian with a medical school or a university, we request that you acquire the book this way for your collection. This book will be of great interest to a wide array of disciplines. Obviously, anybody working in the field of pediatric neurology, rehabilitative medicine, neurology in general, respiratory studies. Here's what the cover looks like. The thesis is also available in PDF format for students and other interested parties. It is a technical document, so it's not necessarily the best place for people that want to understand Linda's work better to go first. However, if you do have scientific and/or medical training, this document is extremely comprehensive. Let's dive into the document right now. Okay, here we go. Table of contents. Chapter 1. Why look at breathing as a possible problem for children with cerebral palsy? And possibly one of the most important parts of this chapter is a review of all the clinical work that has already been done on the subject of breathing and cerebral palsy. In chapter 2, entitled Cerebral Palsy, Linda goes into great detail on what is known about the condition and how it is described and how it is currently treated. Chapter 3, current knowledge relating to the search for links between brain injury, motor disability, and abnormal breathing. This is a very thorough review of the literature. There's quite a bit of scientific work that has been done over the decades on this subject. But as is often the case, it is siloed in the literature of specific subspecialties, and no one has ever brought it together into one place before. Chapter 4, the interaction between the development of movement and breathing. This is highly original work, and it forms the basis of Linda's therapy by retracing the course of motor development in infants. The breathing apparatus can actually be rehabilitated. Chapter 5, a comparison of the chest sizes of normal children, children with cerebral palsy, and children with other disabilities. And in this chapter, it becomes very clear that in every case of neurological condition, there is a corresponding change in the child's body, and in this case, the focus is on the chest. Chapter 6, abnormal breathing and symptoms prevalent in cerebral palsy children. This is a deep dive into the unique qualities of breathing with children who have cerebral palsy. Very detailed study, perhaps the most detailed study ever done. Chapter 7, rocking cradle and massage crossover study. This is a very interesting chapter. It introduces the idea of the rocking cradle, which is something that we really should be talking about restoring to therapeutics. Very effective, inexpensive methodology for helping people of all kinds, with all kinds of neurological conditions. Chapter 8, the effect of a manually delivered therapy on the breathing and function of cerebral palsy children. And this is again, a central part of Linda's work, in addition to movement therapy, which she does in a very unique way, but based and rooted in the known science. She has also developed a therapy for rehabilitating the breathing mechanism of children with cerebral palsy, and really anyone who has a deficiency in their breathing mechanism. And here she takes specific subjects, starting at 0, taking them through the therapy and measuring their progress every step of the way. This also includes commentary by clinicians who are familiar with the individual patients. A lot of detailed studies on a lot of individual subjects. Chapter 9, additional case histories. Chapter 10, cerebral plasticity and the Scottson technique breathing therapy. And this is where some of the theory as to why this works, why this approach works so well. And it's rooted in the reality of cerebral plasticity, something that is well known by science, but something that science to date doesn't really know how to take advantage of. And the work that Linda does is a major breakthrough in actually utilizing the reality of cerebral plasticity rather than just talking about it. Chapter 11, review and critique of previous chapters, lots of tables, and we'll just go through that very quickly. And I also want you to see quite a bit of documentation, quite a bit of documentation. Let's go through this very quickly and see if we can show you some of the things. A lot of photographs. Yeah, we're just if somebody wants to read the whole thing, I guess they could slow down this video and read it this way. It's quite a big document. When it's printed out, it comes to over 600 pages. And the interesting thing about Linda's work is, number one, it's absolutely revolutionary. And number two, every single piece of it can be traced back to something that is already known and has already been established by the traditional scientific and medical community. So there are no stretches here. There are no leaps. She has simply taken a vast amount of already established science and medical practice and integrated it in a brand new way that has absolutely revolutionary results. This is not a modest improvement in the conditions of the children. It's nothing short of a revolutionary improvement. This is the equivalent of thumbing through the thesis page by page. So if you're inspired, if you're a librarian in a medical school or in a university, and you're wondering, is this worthwhile for your customers, your students, your clientele? I think you can see that this is a very detailed and very carefully assembled thesis. Linda also, for the purposes of preparing this thesis, was using an instrument to measure breathing function. A unique instrument, by the way. It's improvements have been made on it, and we're hoping to acquire the rights to use the new instrument. But this thesis, in addition to all the other things it does, introduced an absolutely brand new, easy to administer, inexpensive methodology for evaluating the breathing apparatus in any individual, not just children with cerebral palsy, but any individual. And this is a most important development because to date, uh, the, the, the instruments used to evaluate human breathing are nothing short of primitive. And this new instrumentation uh, represents again another revolutionary improvement in understanding breathing. And if you consider how important breathing is to every single biochemical function in the body, including the functioning of the brain does not live long without adequate breathing. You realize that this is a very important subject for science and medicine to be paying very close attention to. Okay, here's an example. Right, this is a subject, 4 years old, spastic, quadriplegic, cerebral palsy, um, non-ambulant, can't move, but can sit with some assistance. That's how this subject started. This is what her breathing looked like via the recording of the instrument, and this is what it looked like during the treatment. So you can see there's a definite change of pattern during the treatment. So there's lots and lots and lots and lots and lots of these for people to study. And let's see if we can find some photos. Okay. Um, Linda, by the way, is very good at creating a very positive, happy environment in her clinic. So you'll see the children smiling. So on the left, this is a good one for understanding. So in addition to controlling the breathing, the diaphragm also is a most important postural muscle. So one of the reasons that children with cerebral palsy cannot sit up is they have underdeveloped diaphragms. And that also contributes to a deficiency of oxygen reaching their brain. So it's most obvious, the problem is most obvious in sitting. So here's a child who cannot sit unaided. He just can't do it. Okay. After 12 months of the manual therapy, which by the way, does not require a PhD or an MD or anybody special to do it, the family members learn how to apply the therapy. And Linda is a supervisor for them. But this is something that families can do for themselves. So here's this child who was unable to sit up by himself unaided, probably would have gone the rest of his life unable to sit up unaided. And here he is 12 months later. Needs a little help, but clearly he is much, much sturdier. Why is that? It's because his diaphragm, the postural muscle of supreme importance, has now received a huge boost thanks to the intervention. And the improvements continue. This is just 12 months in. Here's another example of a child. This child cannot quite sit up by himself. He's got to be helped. And here he is, 11 months later. He needs his hands to help himself, but he's doing it by himself. Again, it's the diaphragm. There is no other known therapy. Here's a child who's holding himself up, needs his arms to sit. Here he is. His diaphragm is now strong enough to allow him to sit unaided. The important point here's a little girl. She's kind of hunched over, and here she is able to sit up much straighter. Uh, this child as well needs assistance within 13 months. He is sitting up by himself. A big triumph. Now, so he's sitting up by himself, but you can see the collapse, right? And the head jutted forward. And here he is now sitting up quite nicely after 10 months. The point I want to make here is the thesis exists. It is based on known science, though no one else has put the science together. It is a therapy that As far as I've been able to find out, only Linda Scottson uses, and it achieves spectacular results. And it is something that families can be trained to do to help their loved ones. Again, if you're a doctor, serious doctor, or a scientist who wants to see what's possible in the treating of cerebral palsy and other serious neurological conditions, you can get this thesis and study it. If you're a librarian at a medical school or at a university, you can see that this is a very worthy document. Um, if for some reason you have a genuine interest in the subject and just simply have no resources to acquire a copy of this thesis, please write Advanced Center and we'll see what we can arrange to assist you.